Hello, Mr. C. Again, my name is Phoebe Aguru. I'm going to be a nurse practitioner today doing your health and physical assessment. All right?
Okay.
Good. We've already conducted a health history on Mr. C. We're going ahead to do his health and physical exam. And while we're doing the physical health history, we did checked Mr. C's vital signs, his height and weight, and calculated his BMI. And we also conducted his visual exam using Snellen chart and Rosenberg for short distance vision. Okay. Looking at Mr. C's facial structure, Mr. C is alert and oriented. He seems happy. He's not stunned. He doesn't have a stunned look or dazed gaze. Looking at him, his affect is appropriate to the situation. Okay, I'm looking at his skin and hair. The hair on his skin, on his upper hand extremities are evenly distributed, and on the right side and as well on the left side. And I'm checking to see if there's any lesion on his skin, redness, rashes, any moles or anything that it will call my attention to his skin. I could see no lesions. If I see any lesions, I will be using the A, B, C, D, E of lesions to check for the color, the A for asymmetry, B for borders, C for color, D for diameter, and E for elevation. I'm palpating Mr. C's skin and skin. There is nothing. Mr. C, do you feel any pain?
No.
No pain. Okay, checking his thumbs, his fingers. The capillary refills are less than 3 seconds. On the left side, less than 3 seconds. And I could see on the right middle finger, the phalanx part of it is cut off. From the accident Mr. C sustained previously when we discussed his health history, he told me that he had accident back in April of 2015. The right middle finger phalanx portion was amputated from that accident. Okay, there is no clubbing on his nails, no clubbing noted, which could indicate some oxygen issues, and there is no cyanosis noted on the color of his skin. All right, we're gonna move ahead to his hair. Mr. C, looking at his hair is not long enough that I could not see. I see an evenly dispersed hair distribution together with his the beards. He has sparse distribution of gray hair on his beard and on his hair. I'm palpating Mr. C's head. Tell me if there's any pain as I palpate.
There's no pain.
No pain. All right, no pain as I palpate. No lesion, no moles, no erythema noted. No scars of healed, any wound noted on Mr. C's head. Okay, while I'm on the head, I'm gonna be checking his temporal artery right here, palpating +2 pulses palpated over here, and I'm gonna be listening to the temporal artery as well, using the bell of my stethoscope for any bruising. There's no bruising on this side as well. Okay. So talking about pulses, I'm going to be checking Mr. C's radial pulses, +2 radial pulses palpated, +2 brachial pulses palpated. Okay, back to his hair, to his facial structure, down to his eyes. If I had an ophthalmoscope, which I do not have for this exam at this moment, I would have conducted a full fundoscopic exam, and I will check for retinal red reflex, and I will check for if there's any hemorrhage in his eyes, the optic nerves and optic discs. But I'm going to be using just my pen lights to check for his light reflexes and direct and consensual reflexes of the pupil. But before then, I'm inspecting on his eyes for symmetry. I could see the eyes are centered and are symmetrical. There is no edema or periorbital edema noted. There is no edema on his eyes. Mr. C, I'm actually going to palpate with my hands to check his conjunctiva, his sclera, and looking at what I'm seeing, it doesn't appear to be any problem right there. I'm going to okay. Conjunctiva, there is no redness, there is no discharge, there is no edema over there. Checking the periorbital area as well on the upper section of his eyelids. Okay. I could see no redness, no erythema or no swelling up there as well. Mr. C, I'm checking for your temporal sinuses. Do you have any pain?
No.
No pain. Maxillary sinuses?
No pain.
No pain at all. Okay, so I'm going to use my pen lights to check his pupilla, which stands for pupil reaction, pupil round reactive to light, and accommodation as well. Okay, all right, Mr. C, I'm gonna come through just open your eyes, mommy. No, just look, keep looking. Okay, the left side. Okay, pupil is a response to light and is reactive. I'm gonna be checking for. I already checked for direct, and I'm gonna check for consensual response. Okay, looking at two pupils, yes, both of them responded at the same time, and that round and equal. All right, I'm gonna be checking for the cranial nerve 2, which is of course optic nerve 3, 4, and 6 for motor movements of his eyes. So I'm going to be checking for the extraocular eye movement of the extraocular eye movement using the 6 cardinal points of gaze. All right, Mr. C, just follow this. Follow my hand with your eyes. With your eyes, okay. Okay, the pupil, the 3, 4, and 6 cranial nerves are intact. There is no strabismus or abnormal jerking and movement of the eyes noted when I checked it. So I'm going to check for accommodation. Mr. C, you're going to look past this pen. Okay, look past this pen, then you're going to focus on the pen as it comes towards their nose. Okay, let's go. Okay, his the 2 eyes, the pupil, they all accommodated and they all responded for using this to check for accommodation. All right, so Mr. C, I'm going to check for your cranial nerve 5, which is the trigeminal nerve. Because I'm here on your face, so I have a sharp and dull end of this thing. When I check on the 3 axis of the trigeminal nerve, I'm going to touch your skin on the face with this. Then you're going to tell me if it's sharp or dull end that I use. Okay, you're going to close it. Oh, hold on. This is the sharp end, and this is the dull end. Okay? Yeah, close your eyes, Mr. C. You're going to tell me if I use the sharp or dull end.
Okay. That's the dull end.
The dull.
That's the dull end.
Okay.
That's the dull end.
Okay. On this other side.
That's the sharp end.
Okay.
That's the dull end.
Okay.
That's the sharp end.
Okay. All right. So the trigeminal nerve is intact, And Mr. C, I'm going to be checking on your facial cranial nerve 7, which is the facial nerve. Are you going to smile for me? Okay, he's smiling. And can you frown? No, I need you to frown. Okay. Can you puff your cheek for me? Puff. Both sides. Just, yeah. Okay. Miss, the cranium of 7 is intact. Okay. Moving down to Mr. C's his ears. I do not have my ophthalmoscope again, my otoscope, okay, but I'm going to be visualizing the ears. So I will not be able to do a complete exam on checking the inner ear with the little pen light I have, but I'm going to be able to see some part of the exam. Looking at his ears, I'm visualizing and inspecting. There is no lesions on the auricle, the external part of the ear on the right side as well. There is no lesion noted. No incident, no discharge that could be noticeable at this point. Mr. C, we're going to be checking your cranial nerve 8 for hearing. Okay. You're going to close your eyes and I'm going to whisper some words, and then so that you closing your eyes, you will not be able to read my mouth movements, okay? I'm going to whisper some words, then you tell me if you had it on the right side. I will check on the left side as well.
Okay.
Close your eyes.
Right.
Okay.
Grace.
The cranial nerve 8, vestibulocochlear is intact for hearing. So I'm going to be checking with my pen light to see his tympanic membrane, to see if there's any discharge, any exudate coming out, if it's any redness or erythema in there, or any edema like bulging tympanic membrane. For a male, for an adult, I'm going to be pulling upwards and out, but if I'm inspecting a child here, I'm going to be pulling downwards and out. Okay, gonna turn this way. Sorry. Hold on. Good. Tympanic membrane pearly gray noted. No exudate, no discharge coming out from his ear on the right side. On the left side, pearly gray tympanic membrane noted. No discharge, no exudate, no polyps or anything hanging out in there. All right, that's fine. Can you open your eyes? Okay. All right. I'm going to be palpating his around his ears to make sure. Tell me if you have any pain as I'm palpating.
No.
No pain. Okay. No pain?
No pain.
Okay. All right. So since I'm over here on his face area, I'm going to go ahead and go to his nose. Inspecting, I'm noticing the color, the symmetry of his nose, how it's centered to his face. He's centered, and I see no swelling, I see no erythema, no drainage from his nose. And as well, I'm going to be using my pen lights to look into his nose if there's any swelling. And of course, we're going to check for patency. Mr. C, sorry, can you close one of your nose and snip back? Good. The other one. Do you feel like there's any blockage there?
No.
Okay, so there's nasal septum, there's no deviation of nasal septum, and I'm going to be checking to make sure with my pen light. Okay, is patent on the left, right? Patent on the left. Okay. If there's any drainage, do you normally have any colds? We already talked about it. You say you don't normally have colds all the time, and there is no dripping or post-nasal drip. Do you feel like you're swallowing some drainage from your nose?
No.
Okay, no patency. Do not hear him sniffle back anything. The nose is patent from what I could see, and the turbinates in there are actually intact. Okay, there is no swelling noted there. All right, so Moving down to his mouth, Mr. C, can you, looking at this symmetry of his mouth, that all symmetric, the mouth is symmetrical, is centered to his face, and I do not see any drooping of face on one side or anything. Mr. C, can you open your mouth for me? Okay. Checking cranial nerve 9 and 10, the tongue is centered in his mouth, and I'm going to be using my pen light to visualize. Okay, there is no dental caries noted. The soft and hard palates I could see, and are intact. The tonsils are not swollen. They are not erythematous. They are not yes, it's not swollen. Okay, I'm going to continue. Can you open your mouth again? Do you have any pain on your teeth? Any pain issues on your teeth?
No.
He does not have any loose tooth. The teeth is complete. I will elicit his gag reflex with this, my tongue blade, and it will actually give me a better visual perspective of inside his tongue and mouth. Okay, can you open your mouth? Okay, the uvula is intact, it's centered, and these tonsils, like I said, are not swollen. All right, so that's fine. And Mr. C, this also checks for cranial nerve 12, which is hypoglossal. And can you say yeah, again. Uvula moves as he is saying so, and is centered. Can you stick out your tongue for me? Cranial nerves 9 and 10, and of course hypoglossal, because he could swallow, is intact. Okay, and the tongue, as he stuck it out, is not deviated to one side, so he does not have any neural issue right there. And Mr. C, I'm going to be checking the strength of your tongue. You're going to resist my push on this side with your thumb.
Okay.
Okay, that's strong. The tongue is strong. Cranial nerve 12, hypoglossal. Good. All right. Okay, Mr. C, we're going to move ahead and go down to your neck area. Check looking at Mr. C. His face is centered, and his neck is centered. I see the cartilages, the trachea cartilages centered, and inspecting, there is no lesion, there is no redness anywhere, there is no anything that is worth noting there. I see his hyoid and cricoid bone, which is appropriate for his sex, for his male gender. Okay, so looking, and while I'm here, I'm going to use that opportunity and check for his lymph nodes. Mr. C, tell me if there's any pain anywhere. Pre-auricular?
No pain.
Post-auricular?
No pain.
Okay. Tonsillar lymph node?
No pain.
Okay. Submandibular?
No pain.
Subtemporal lymph node?
No pain.
All right. So here on this axis is the superficial anterior, deep cervical chain, post-cervical chain, and supraclavicular, occipital. Any pain as I touch all of them?
No pain.
Okay. All right. So there is no pain there. All right. So using a frontal approach, I'm checking Mr. C's the thyroid gland, and I'm going to give him a sip of something to sip so that I could look and palpate as well whenever he's swallowing for any redness, any edema, any pain. Go ahead and swallow. Okay, so yes, go ahead again. Good. So there is no pain right there. There is no pain. The thyroid gland is intact. And I will also use a posterior approach. I'll go through his back to check for the same thing, but for the purpose of this exam, we're going to go ahead and continue. All right. So Mr. C, I'm going to check his Mr. C's spinal accessory nerve, which is cranial nerve 11. So you're going to resist my hand when I'm checking the big muscle up there. You're going to resist my hand pushing you down. Oh, yeah, shoulders down, okay?
Okay.
Good. Spinal accessory nerve, which is cranial nerve 11, is intact. All right. So I'm going to, since I'm up here, let me go ahead and check his axillary lymph nodes. Any pain anywhere?
No pain.
No pain axillary lymph node? Okay. All right. Okay, Mr. C, I'm going to go ahead and check your, looking at his chest and lung area. I'll go to the back and do inspect. Can you take off your shirt for me, please?
Okay.
All right, inspecting his back and lungs area. I'm checking for anterior, posterior, transverse ratio, which is appropriate. There is no issue. I'm not noticing anything as far as using accessory muscles to breathe or retractions at all. Barrel chest as if he has COPD, so his lungs look good from what I could see. I'm going to touch. Tell me if you have any pain anywhere.
No pain.
Okay, so I'm going to check for his lung sounds on at least 6 areas at his back. Deep breath. Deep breath, deep breath, deep breath, deep breath. All right, and checking for expansion of his lungs with my 2 hands. Okay, go ahead and take a deep breath. Okay, the lung expanded equally from the back, and coming to the front, I'm going to do the same thing. I'm going to be listening from the right side, 6 areas on his lungs filled. Deep breath. Clear. Okay, take a deep breath. Deep breath. Deep breath. Deep breath. All right. Clear lung fills escorted on bilaterally, front and back as well. So checking on his, listening to, we're going to go ahead and listen to his heart sounds. From the sternum notch area here, I'm going to be checking to see second intercostal space right on the sternum is aortic sound. Aortic, second intercostal space across it, pulmonic, mitral. No, herbs first before mitral. Okay. No, I'm gonna start over again. Aortic, pulmonic, herbs, tricuspid, mitral at the 5th intercostal space, and right beside it is the point of maximum impulse, which is right from the mid-clavicular line down to the tip of, to the middle of his nipple. Right here is the point of maximum impulse. I'm going to palpate to get his PMI, and then I will auscultate for his apical pulse right there. All right. Okay. So, Mr. C, it's time for us to check your abdominal area. Can you please lay down for me?
Okay.
Okay. So, looking, there is no hips or pulsations. Remove your hand from here. From an eye level, no hips, no pulsations noted. Okay, Mr. C, can you raise your head at a 45 degrees angle? Good. jugular vein distension is not noted here, and he's not having it. Are you having any pain while you raise? No pulsations, no heaves on his abdomen. Okay, I'm gonna auscultate first the abdominal sounds, the four quadrants of abdominal sound. Okay, so I'm going to auscultate again on the aortic artery to see if there's any brewing. Renal artery, any brewing, and inguinal artery for brewing. There is nothing noted, and I'm going to be percussing first. Tell me if there's any pain.
No.
All right, I'm going to palpate with light palpation, checking for his organs, the liver, and spleen, and if there are masses in his abdomen. Then we're going to do a deep palpation. All right. While I'm here, Mr. C, I'm going to check your femoral pulses, okay?
Okay.
All right, palpated. All right, looking at the his leg side on his legs, I could notice an injury that he sustained from April of this year. He told me 2018 when he had the concussion, fall accident with from his truck, and he had a concussion. He broke. He got a deep injury on his tibia line down here, and it's all properly healed. So other than that, there is no other. It's just a scar, which is healed scar. There is nothing noted on his body. This hair on his legs are evenly distributed. As I'm palpating, do you feel any pain?
No.
There are no masses noted here. And I'm gonna, while he's here, I'm gonna check for his popliteal pulses. Palpated. All right. Pedal pulses right here, palpated, and posterior tibial pulses palpated. I'm checking his right here. I don't know if you all could see me. Checking his capillary refills on the toes. That are less than 3 seconds. I could see no clubbing on his toes, and there is no lesion noted, no erythema anywhere. Mr. C, can you find your legs outward for me? Find your legs outward. Find your legs outward for me. Okay, inwards. Checking for range of motion, resist. Okay, all right, can you stand up real quick?
Okay.
All right, so, okay. Okay, can you walk forward, take a couple of steps on your tiptoes? Tiptoes forward, backwards, on your heels.
Okay.
On your heels backwards, yes,
Okay.
sorry.
Forward.
Tiptoe forward, time. Backwards, on your heels, good. All right, so checking Mr. C's spine, there is no abnormal curvature, is straight, and yes, his spine is straight. There is no abnormal curvature right there. And Mr. C, can you extend your hands, checking for pronator drift? Okay. All right. Okay, that's good. There is no pronator drift noted. Can you close your eyes? Doing Romberg test for cerebral function. There is no swaying, and Mr. C, cerebral function is intact. Can you sit down, please? Sit down. All right, we're going to be checking your reflexes, Mr. C, and actually your range of motion on your hands. Push. Good. Pull me. All right, squeeze my hand tight. Okay, so your elbow, you're going to resist me. Good. Can you find your hands outwards, upwards? Hyperextend, great. All right, so let me go ahead and check your reflexes. Okay, right here is, well, okay, good. Good. Something. Okay. The tricep is good. Bicep is good. All right. Brachioradialis. Good. Brachioradialis. Good. Patellar reflex. Okay. Patellar reflex. All right. And can you raise your... Okay. I'm going to check for the Babinski reflex. Good. Babinski. Good. All right. Okay. So, Mr. C, we already checked the strength of your... let me go ahead and resist as I push down. Okay, that's the strength of his legs is intact right there. He has +4 strength on all his extremities. Mr. C, thank you so much. This concludes our exam, physical exam. Thank you for going through this process with me. I appreciate all your help.
Thank you so
Thank
much.
you.